Hello and welcome to Acupuncture Professional. My name's Catherine Berry and I'm here with Dr Yair Maimon. And look, my first question for you, Dr Maimon, is what got you interested in Chinese medicine in the first place? Where did your journey start?
I can say as a lot of people, and a lot of time, especially when I speak to a large audience or to people who practice Chinese medicine, I always have the same feeling, and it resonates with everybody, that somehow Chinese medicine chooses you and you don't choose it. So it's a kind of, I think, a dual thing. You don't kind of chose to be Chinese medical practitioner. Suddenly it appears in your life and you follow this path. So in this respect, but I can see what made me to go on this path. And I must say, I never had regrets. I started on Chinese medical career quite early on in life without any prior knowledge. At this point in time in Israel, there was no one practicing Chinese medicine, so I had nobody even to refer to or to relate to or to ask what it is. But I just felt that's what I need to do in my life, and since that moment, never had any question about it. But I must say there was two things that were occupying me, and they're still the same two things. So I think they put me on the path of Chinese medicine, and it's still something I'm mostly kind of interested in, inspired by, moved by. And these two questions are, one is what we are here for. I mean, as humans, we feel this strange, I don't know what to say. We feel this strange feeling that we're coming from a timeless place into a timed place. This is, for me, this whole issue of Jing and Shen, and being so interested in understanding deeper the working of the Shen in the body, the working of the Jing. And that pushed me on a very long path of very long journey of inquiring more knowledge and information and reading more classical texts and going all around the world and studying. I'm 30 years or more a student of Chinese medicine, and I was lucky with very good teachers. And so I think this first question, that what we are here for, is still something that is deeply moving me. And I feel the deeper I go in Chinese medicine, and especially the more I see patients, and the more I look deeply into understanding and resolving clinical situation, the more I feel I'm closer to the place where I can feel better at peace with it. I can't say even fully understand. I have much more understanding. Sometimes I have a really deep inspiration and understanding of what goes on in human life. But as I said, this was really the first question. And the second one is really the root of suffering. I mean, it's something that, especially with my family background, has been bothering me from early age, to understand why there is suffering, why human inflict suffering on other humans, why we inflict suffering on ourselves. Why we are not at peace with ourselves. It seems that other animals and creatures, they kind of comfortable. They do what they do. A fish is a fish, a dog is a dog. Somehow humans, we always want to be something else, or we want to, we never feel comfortable with who we are, or we want to change in one way or another. And on the other hand, there is a lot of suffering that we are inflicting upon ourselves, upon others, upon nature. And on one hand, it seems very unfair, and on the other hand, it seems that it also has a reason. And to me, as my life quest is really to alleviate the suffering, to find a way how I can be involved in actively in easing suffering. So I think these two kind of main motives are still the same. They didn't change, and I think they have an endless depth. So the closer I get to them, I think the more authentic I am. And that's maybe what I can share, some of the authenticity, because you start from a very, I think, wide and unease quests and unknown, not knowing where to turn, and always feeling at less, always feeling, you'll never find out any deep answer. And I think as times goes on, you become more authentic with the question and becomes more clear with some glimpse of deep answers.
And I think that certainly, some practitioners have expressed to me their concerns around reaching a place of losing confidence in what they're doing and, feeling, perhaps in a dark place in their profession. And have you ever been in a place where you doubted what was going on or you couldn't make sense and perhaps had to navigate your way through that period in your professional life?
Every day.
That's really enlightening. Yeah.
I don't think it is, actually just now I gave like a lecture, and I'm going to give soon another lecture on the same topic. And the topic is, what do you do when you don't know what to do? And I've interviewed many practitioners who have been practicing at least 20 years or more to ask them what they do in this situation, wherein they feel it can be on an individual case, when you treat somebody or when you are involved in, sorry, I'll just have to put on. When you are involved in the clinic, in treating people and you don't know what to do, and it can go larger. What do you do when you don't know what to do? I think it's something we face on a daily life. The question is much more complex. The question is simple, but the answer is much more complex. And I can give one glimpse to it later. I don't think it's to do with this talk, because I actually give practical answers. What do we do? Because apparently a lot of masters along the history of Chinese medicine had developed different solutions to the situation where either you want to address something very large, you're not clear with the specifics, or you just do something which you think will set something into motion, or a healing motion. Healing is always to do with some kind of movement. So to set up a movement, a healing movement, is very much to do with a set of points. So I won't go into the practical side. I'll give you one glimpse into what you do when you don't know what to do. And I took it actually from, the hint is actually from psychology, from nonverbal communication. I think it was Bion who said you put up a beam of darkness. And a beam of darkness actually means you set up space. In order to something of deep importance of healing to emerge, if we follow the Chinese medical tradition, we always go up the ladder, which means we start with unity, we start with shen, and the more we go down in the numbers of 3, heaven, man, earth, or 5, the 5 elements, the wu shen, the 5 wheels, the more we go to the jing later, the more we go into individual plane. But when we go in treating disease or treating someone, the more we are trying to go back to unity. So we're going from the disease, from the jing level, the most yin level, the most personalized level, to somewhere which is non-personalized. And this kind of motion from something which is very yin, very material, into something which is non-material is always a motion, again, in Chinese medical understanding, to Shen and to Dao. And one of the most amazing concepts is the concept of Wu Wei, the concept of doing without doing. To us as Western people, it sounds almost disturbing. We like to do, we like to be engaged. Doing and non-doing is the concept which, we find kind of very strange to us. And immediately when we feel uncomfortable, we start to do something. And putting a beam of darkness for me is actually doing the opposite. Is you feel you don't know and you wait and you do nothing. But the decision to wait and do nothing and allow the patient's inner life to appear is actually the real, can be a real strong, both healing but also diagnostic tool to understand what really goes on and how you can best interfere. By the way, as practitioners, we always interfere with something. We set things off balance, not into balance, which is different to what people think. It's actually, we are causing an imbalance rather than a balance. So so I think one of the deep understanding. And I go back to the first question. What are the deep understanding of that we live in a place that is between heaven and earth, is between a place which has a different dynamic, a timeless dynamic, and we live on earth which has a very material yin time dynamic. And from the earth point of view, we are here for a certain period of time, from a, sorry, I'll just move it. And from the heaven point of view, it's all timeless. And man is in between these two dynamics. So being in between both of them, I think it's something which is a core and deep understanding.
And so I have a question for you about the practical application of that doing nothingness. So when you don't know what to do, you do nothing. And do you mean that, in a consultation with a patient, if you're feeling confused by what's being presented, that you literally hold the space until it feels like something surfaces? And my second part of the question is, in a previous interview that we did around work that you specialise in treating trauma in the shen, that I know that one of your skill sets is being able to create a very open and earnest space very quickly. And perhaps you can help us with some of the line of questioning that you do in terms of building that rapport, and just how you get to create a space and hold that space in a very short amount of time.
I'll start actually with the second part, because I call it magical questions. I think there are questions that are opening doors, and I don't think we treat just with needles. By the way, diagnosis to me is one of the core treatments. Accurate diagnosis that doesn't just set the treatment right, but actually this type of engagement with the patient. And as that refers to the first part of your question, is actually really setting up a very different dynamic, a healing dynamic in the patient. So a magical question, one of the most magical questions, and we can even practice it once if you want. Sure. It takes 1 or 2 minutes to go to the deepest part of the patient. Sure. Is the question why? And so if somebody says, I have a headache, ask him, why do you think you have a headache? And then he will give an answer. And then I think, why do you think you have this? And within 2 or 3 whys, we are in a very deep core imbalance and quest of the patient's life. And I always have this image in my mind when I say to Father Lar, who was one of my mentors, who said about the suen, it's called simple questions. So if you want to frighten somebody, ask them simple questions. So the whole tradition of Chinese medicine is based on questions and answers of the Chipo and the Yellow Emperor. But in the clinic, really, it's based on asking to the depth of the patient. And I think one of the best questions, and I have a list of them, who are really magical questions, who are setting up something different. They are based on a simple question is why? Why do you have it? What do you think is going on? And patient very fast will answer, and will give you a very deep understanding of their life, their suffering, their pain. And I even say up to the point that they'll give you which acupuncture points you need to use.
In what
if
way?
You listen well enough.
In what way will they do that?
They can say that deep inside, I have this deep sadness. I can't let go of something that happens sometime in my life. They'll tell you, treat the lung, do lung 9, lung 3, Or I feel so lonely in the world, and they'll point you to the heart or the pericard. So if you really listen to the Shen story, to their life story, they will unfold it. This is why, the more we create a space, the more we look deep, the more things will happen. I don't think it's my daily experience. And that's how I try to teach.
I've just turned my video off because it pixelated slightly, and I think because of the internet connection. But I'm so fascinated to hear from you these questions that you have, because so much of the work that I've been reading recently with Dr. Leon Hammer and other great masters of Chinese medicine all talk about creating and holding a space where you can communicate with the shen, and that's where your shen is communicating with the shen of the patient as well. And it seems that that's something obviously throughout your over 30 years of experience that you've refined that skill. But what advice would you have for other practitioners that are trying to learn how to harness that and how to be comfortable with themselves in creating that space?
It is so simple that it's hardly anything that you need to teach someone, And I think this is really the kind of deep essence of Wu Wei, I think we always look to some kind of advice and guidelines. And actually, in this space, there's none. I can give a lot of advice and guidance later, how can you treat it and what do you do when you feel really lost. But for creating a space and for looking deeply into the patient's spirit, I think the guidelines is really have no guidelines. But on the other hand, be very sincere in your own quest, in your own clinical quest, because I think whatever we do in our life, in our especially professionalized life, does reflect eventually when we meet the patient. So the more we are clear with what we are looking at the patient, the more they reveal it. By the way, there's been even numerous research that are showing that patient will tell doctors different things according to what he allows them. So if they'll go to the orthopedic doctor, they'll talk about their pain. If they'll talk to the GP for the same problem, they'll say a bit more. And if they'll go to someone like they think can listen or hear more, they will tell him more. So there's been quite a lot of research of the patient will reveal different things according to the space which is created for them. And I think in Chinese medicine, we are very lucky because people have no expectation. They don't come to the psychologist. They don't come to their professional medical doctor. So whatever we allow, whatever we create, immediately will happen. One of my favorite lectures, actually, and this maybe helps it, is 1 minute diagnosis. It talks about that 50 to 80% of the diagnosis is done actually in the first minute. When we look at a patient, like if I look at a patient and I see sadness, I'll immediately go there. My interest is immediately focused on that, and the patient will open up in this place. Of course, if my interest was his back pain, he will talk about his back pain. So I think the more your interest is into the shen of the patients and into unity, things will happen. And as far as guidelines, I think the only guideline maybe is just to try to be authentic at that point, So that's the only thing, don't try to hide to be different than who you are. So I hope that it answers your question.
It does. It's interesting though too, as you've identified that you've developed these skills. What's your advice for people? It's obviously when you're involved in very deep communication with a patient that they can reveal a lot of information. What strategies do you have in place to debrief or supervision, or how do you then go back to your ordinary life if you've been exposed to a say somebody's I know that's your specialty, somebody's trauma.
Yeah, I do a lot of trauma treatments. Well, I'll answer the first thing. I think that everybody who's doing Chinese medicine has the skills, because otherwise he wouldn't choose Chinese medicine, or as I said, Chinese medicine wouldn't choose him. It's like a painting, if you don't have the skill for painting, you won't find yourself painting. So I think we all have our natural skills to look deeper and understand deeper. And so it's really allowing them. And the main word that comes also in my lecture about what you do when you don't know what to do is the word trust, And I think maybe the difference between someone who begins and someone who practices more is that you trust that you don't know and it's okay. And you trust that you did your best. It doesn't mean to be lazy, but I think your amount of trust in healing, in your abilities is growing, and therefore you feel more at ease, and that's why I say more authentic and more allowing the patient to reveal their inner self. as far as going to my daily life, I think there's this great phenomena that after a day of practice, I usually feel more refreshed than when I started, and almost all the time, all these years. And I think when you're engaged in something which you're really inspired by, it doesn't kind of, in a sense, rub on you, even the traumas, the difficult parts of the patient. I'm just there to be there for them. I don't take it personally. And I treat a lot of cancer patients. My special part is cancer and cancer research. That's actually where I do my very deep kind of appreciation of Chinese medicine, even on molecular level, especially the herbal medicine. So nobody can accuse me to be too spiritual, so to speak. I do a lot of very down-to-earth laboratory work, and still the same ideas with the same set of belief and understanding, or it's not a belief, I call it the science of Chinese medicine. I follow the same rules. So I feel that in this sense, all you have to do is really have a bit more trust in the science of the medicine. I mean, Chinese medicine is very powerful. It has been proven. Again, totally the other side, what I teach is the evidence base of Chinese medicine, and especially in oncology. There is a lot of scientific proof. Sometimes people in the profession even are not aware of. So it's a powerful science of medicine. Luckily, it has its depth, endless depth to understand human life and to treat to the depth of human life, both to treat the pain, traumas, but also to create healing in a very unusual way, or encourage or stimulate healing in a very unusual way. On the other hand, it can treat very physical condition that or can be exposed easily to evidence-based medicine, can be easily exposed to any testing and study. So I think this wealth of medicine is, to me, I feel so lucky that I can do both. I can treat shen and traumas, but on the other hand, I go to the hospital where I have now a setup of research facilities, where I have from lab facilities to clinical facilities. And I feel comfortable in both worlds because they're both Chinese medicine. I think this is where we started. I think Chinese medicine can touch heaven and can touch earth, and therefore understand human, which is in between. In the science of Chinese medicine, we are on the level of 3, and this should be always in our awareness. I think that's maybe the kind of, to conclude the answer. I think when you sit in the clinic and you have this awareness in your mind, in yourself, then things will start to reveal themselves also in the patient. And personally, I never encountered that, if you do it in the correct way, you're just there for them fully. And when our treatment finishes, we go home just feeling at home with ourselves, not necessarily being touched, or with the patients, going home with the patient's pain.
And so to you, just picking up on the word you just said, doing it in the correct way is doing that with authenticity, doing that with an open heart, doing that with the confidence that you're backed by a whole body of research that supports what you're doing. And what's your final message for practitioners who watching today, this resonates, and that are ready to perhaps go to that next level, to start asking those a door opening, I think you said the magic questions to open doors. How would you advise somebody to go to that next stage?
I have to think about it. I think eventually my message will go down to trust yourself, trust your abilities. Do hard work, do the best you can, but eventually trust that what you do is effective. I find that one of the weaknesses, especially when I teach people and try to help people, as you were saying, to go up a level, it creates more trust in Chinese medicine. It's a very effective medicine, and because we live in the Western world and Western medicine is so dominant and so powerful in many different ways. A lot of practitioners, and I think also because of education, we are exposed to Chinese medicine bits by bits. Our education a lot of times starts with some lacking education, and you have to fulfill it with your own merits, and I think that's why the work you are doing to expose people to more and more knowledge and more inspiration is so important. The same as conferences and other teaching. Because I think there is some lack in the beginning, and therefore people feel a bit lack of confidence. So I think trust the medicine, trust yourself, and I'm sure your results will grow all the time with all the years. I mean, we are on the path of one of the best healing methods. We are on the path of one of the best scientific understanding of how life are, and I think it's a daily inspiration.
Indeed, and I think what I would love for our audience to do today is also recognise that you're not alone. I think that's one of the biggest deficits of working in private practice, and as you say, to have all these powerful experiences, but then when you do it in isolation, that's when you can perhaps doubt some of the magic that goes on with Chinese medicine. What's your, you mentioned going to conferences and things. What's your connectivity, and how's that helped you in your professional life?
Connectivity, you mean as network?
Yeah, network to other practitioners. I know you speak of the masters that you studied with, and do you have other colleagues that you debrief with and get together and share cases, or how do you connect with the profession as a whole?
Well, I'm very lucky in this respect. In my practice, we are almost 20 practitioners. I have a small medical center here in Israel, so on a daily basis, there is a lot of interaction. And as I say, luckily I travel a lot and I speak a lot in different conferences, so I interact with a lot of speakers who became my friends worldwide. So my exposure, I'm very thankful. I think that's the second, maybe, if I want to add up with another note, is I think we should be very thankful. And thankful for being involved in such in healings, and especially in Chinese medicine. And I think the more you meet people of kind, the more you read and expose to information, the more it helps you grow and know more.
That's a wonderful note to end on. We've touched on trusting yourself, trusting the medicine, and the final one being gratitude. So thank you so much, Dr. Yair Maimon, for joining us today and for sharing your insights and your experience.
Well, thank you, Kath, for doing all this work for everybody. Thanks a lot.